You touched on this issue at the beginning of your presentation that I'd like to explore a little bit more with you, if I may, by quoting directly from Dr. Britton, the Director of Center for Tobacco and Alcohol Studies and Professor of Epidemiology at the University of Nottingham, who appeared before us earlier this week. Direct quote from him was, "The reason that I asked to give evidence today on the Canadian bill is simply the clause about making comparisons with the safety of smoking, because I think it is absolutely vital that health professionals can say to smokers, we don't know the long-term risk of these products. It would be much better if you quit all smoking and nicotine use forever. But if you can't do that, then it is a no-brainer to switch to a less hazardous product. I don't think there can be any question that electronic cigarettes are less hazardous than smoking." And then Dr. Hammond, professor at the University of Waterloo, he strongly supported Dr. Britton's position. And I'd like to qualify a bit, because Dr. Britton acknowledged the following as a bit of an add-on to what he proposed to us. And he said, "I think we would all prefer that these products met medicine standards to guarantee minimum risk to users. The reality is that medicine's regulation is too complex and too slow, and people are dying as a consequence of the lack of products while we wait for medicinal approval. Anyway, the compromise we have in the UK is that you can't make a claim that makes it sound like a medicine, but you can say this product is likely to be substantially less harmful than smoking, so make the switch." And that's the end of the quote, this very long quote, and I'm sorry for that, but I think it was really important. So now my question, clearly this testimony puts the whole harm reduction and comparison of risks, namely relative risks, front and center. So does this bill keep, as it says in the bill, any person, such as physicians, for example, from recommending a product using a continuum of risk?
Well, thank you very much for your question. In fact, I think you've raised maybe 2 or 3 different things, and I'll try to touch on each of them. In terms of the ability of a healthcare professional, for example, to be able to promote a cadre, a group of products within the relationship between a healthcare provider and their patient. There would be nothing in this bill that would restrict that from taking place. So I hope I explained that a little bit in my earlier presentation, that the idea would be to limit the promotion of a particular product made by a particular company in a way that would promote the sale of that product. But there's nothing in here that means that, as I said, a doctor and patient could have a conversation where the doctor would say, you know, if you're not already consuming a vaping product or a tobacco product, obviously we don't recommend that you uptake either. But if you're already a smoker, and you're absolutely right that while there are harms associated with vaping products, we know that they are less harmful than tobacco. And so certainly healthcare professionals should have the ability to have that conversation, and others could have that conversation as well, in terms of in the context of a place of sale of products. There could be a general conversation about the fact that these products are less harmful than tobacco products, for example. A couple of other things I'll just touch on. I hope I've made myself clear on that, and I hope my officials will punch me in the elbow if I haven't said it exactly the right way, but I think I've clarified that properly. The other 2 things you brought up was risks to users. That I think one of the things we should emphasize is that there are risks associated with the products themselves sometimes, in terms of things like batteries exploding and protecting kids from being able to open these packages that have nicotine, and there have been cases of nicotine poisoning of children associated with vaping products. So this provides the ability to be able to address risks to users associated with the equipment itself. And the other thing that you touched on was this matter of therapeutic claims, and I hope I mostly covered that when saying that in general these products can be encouraged in the context of a clinical setting. In terms of the therapeutic claims, the reality is, I think that this has been discussed here as well, is that if a product were to say specifically on it, we claim that this will allow you to quit smoking, or this will, be protect you from cancer or something like that, that if there were a specific health claim like that, that it would have to go through the Food and Drugs Act to be able to make that specific health claim.
Minister, when you were giving examples of what will be allowed and not encouraged at the very least or prevented with regard to advertising or promoting vaping products, if I heard you correctly, you said that vendors, those involved in the industry, would be able to use and display, or you didn't use the term display. I want to get clear what you meant when you said legitimate scientific works. What did you mean when you said those would be available? I mean,
So
I would have one interpretation of that, but many others might have another interpretation. Could you help us with that? Because that is the issue of what is prevented in terms of public discussion is a major question around this legislation.
Thank you. And I will start that off. And again, I may ask my officials to clarify, because I know this has been something that you have talked about. And we certainly, again, go back to the spirit of trying to protect youth and therefore not trying to have promotions in the general public in a commercial sense, but recognizing that there may be opportunities. And I think the language that I used in my notes and we want to emphasize is that the prevention are the prohibitions around speaking to the benefits of a less harmful mechanism of using nicotine, for example, through a vaping product, that could be in a scientific research study that was done comparing the long-term effects of using e-cigarettes versus using regular traditional tobacco cigarettes, that it could have reached as its conclusion the analysis that vaping products are less harmful within that scientific study. I don't know whether that you can say that any better than I'm sure you can.
So, Senator, if I may, I think it's important to perhaps take a step back. And I think what's happened is that Clause 39 of the bill, or 30.43, which says no person shall promote a vaping product and goes on to talk about health benefits, has been read in isolation. And in fact, it needs to be read consistently with the part of the Act, which is 18.2, which gives an exemption, which says a literary, dramatic, musical, cinematographic, scientific, educational, or artistic work, and goes on beneath to say a report, commentary, or opinion in respect of vaping. And when you look at those two things together, the real issues, what we're trying to do is prevent the promotion of products using health claims for commercial purposes. The bill in no way sets out to limit how people talk about vaping products. So, for example, and I think our minister tried to explain, but in a vaping shop, the vaping shop could have information including peer-reviewed journals, other kinds of information available. They can talk about the class of products, but they can't do it in a way that makes it promotion. They can't do it in a way to sell their product. They couldn't, for example, put a sign on the wall that says Public Health UK says 95% safer, but they could talk about the Public Health UK report and the findings, both positive and negative, as long as they're not cherry-picking that information to say, 95% safer and this and that. It's really understanding the body of literature and making sure that people are aware of that. So there is a broad range of scope for people to talk about vaping products. There's a broad range of scope for people to have opinions, publish scientific information. But they can't publish an opinion if they're being paid to publish that opinion. So if I'm paying you, Senator, to blog about my product and say positive things about it, that goes into commercial promotion.
I understand that the specific terminology used was a legitimate scientific work. Okay. Now, if reading through the lines in what you are responding, that would suggest to me that if it is an article appearing in a refereed scientific journal, that could be made available within the vaping shop, but would not be able to be part of a formal advertising promoting vaping. Is that correct?
That is exactly correct.
If that's exactly correct, that's the language I'm going to use from now on. Thank you very much.